The ReMediES project brought together researchers and competitors as partners to reimagine how we trial, manufacture, package and distribute medicines. Its aim is to make British medicines manufacturing the best in the world and the best for patients in the 21st century. More than 12 million of funding from the UK Government and the Scottish Funding Council was matched by funding from 23 industry partners, led by GlaxoSmithKline and with research led by the University of Cambridge's Institute for Manufacturing. The project ran from 2014 to the middle of 2018 and created more than 80 new high-value jobs and safeguarded a further 400.
The way we supply clinical trials with medicines can be really inflexible. ReMediES has pioneered a just-in-time clinical pharmacy, which will hugely reduce inefficiency and waste. Looking ahead, this has the potential to help us to get new drugs to market more quickly by allowing investigators to introduce and respond rapidly to early results. In primary manufacturing, we have made important steps to reducing inventory and waste associated with batch manufacturing by moving to a more sustainable continuous manufacturing model. This means we can shrink the size of factories we'll need in the future. Factories with greater volume flexibility, able to make medicines for smaller groups of patients more cost effectively. ReMediES has also road tested and scaled up technologies that support right first time quality and yield improvements, allowing us to test and check all the way along the supply chain. We've taken organic catalysis to the next stage, and we've re-engineered the particles for well-established medicines to revolutionize the way patients take them. This means, for example, that a medicine that once had to be injected in a hospital can now be put in a pocket-sized inhaler and taken by a patient at home. ReMediES has questioned every aspect of secondary manufacturing. It has taken steps towards replacing aluminium in packaging through atomic layer deposition. It has developed smart labels that can tell you on your phone exactly what has happened to an individual pack since it left the factory, and has looked at new ways such as mobile phone apps to help patients engage in their treatment, get the information they need for their own safety, and take their medicines in the way they are meant to. And ReMediES has looked again at the last links in the supply chain, from the distribution centre to the pharmacy right through to the patient. Modelling these supply chains has enabled us to better understand the complexity of supply and why we have surpluses and shortages. We have also looked at how digital technologies can help us get information across this extended end-to-end supply chain.
Along the way, ReMediES has worked with the MHRA to develop the supportive regulatory frameworks within which these new emerging technologies will fit, and this will carry on through MMIP. The work of ReMediES will continue. A new Medicines Manufacturing Innovation Centre will be built in Scotland. Two major outcomes of the ReMediES programme, just-in-time packaging and continuous direct compression, will form the MMIC Grand Challenges. A number of new industrial transformation projects supporting the UK's Life Sciences Industrial Strategy Challenge Fund are being developed. ReMediES has shown that by working together, we can seize the opportunities that advances in science and technology are giving our industry. The future looks very promising.